Study Section 13. Health Statistics. Introduction. The collection of meaningful statistics is an important function of a hospital or clinic. Health records are the primary source of data used in compiling health care statistics. The medical record department staff, therefore, may be responsible for the collection, analysis, interpretation, and presentation of statistical data wherever possible. Today, computerized systems automatically collect and calculate many of the statistics that were once previously done manually. Learning outcomes for Study Section 13. At the end of this study section, you should be able to explain the nature of health statistics, identify various sources and characteristics of health statistics. Health statistics. Health statistics serve as the basis upon which government can plan and health managers can assess health trends and situations as well as monitor the progress of various health-related interventions. Statistics are only as accurate as the original sources from which they are taken. The health information management health record professionals should see that medical records and other source documents are complete and readily available to meet the requirement for the production of useful statistics. Health statistics includes information on the following: A. Generally mobility survey. B. Nutritional status. C. Distribution of various levels of some quantitative attributes, e.g., blood pressures, weight and cholesterol level. D. Medical records, e.g., hospital inpatient inquiry. E. Clinical and drug trials. F. Etiological studies. Investigation of factors influencing health. Emphasis is in comparison of different groups. G. Studies on the administration of health services. There are needs for availability, utilization, deficiencies, cost, and manpower requirement. H. Evaluation of health progress, prophylactic measures, e.g., measles, immunization, malaria education program, health education program. Some available hospital statistics. 1. Inpatient data. These are data from patients who are staying in the hospitals. The information here are more detailed and accurate. These include patient's name, sex, date of birth, place of origin, residence, occupation, religion, marital condition, date of admission, causes of admission, type of care and date of disposal, discharge or death. 2. Outpatient data from patients who came to the hospital by appointment. This can be in the form of A. General outpatient (GOPD) data on name, sex, date of birth, residence, and complaint is not generally recorded. B. Regular specialist clinic, all the socio-demographic data for inpatient complaints, that is, symptoms. C. Emergency and casualty cases, e.g., accidents. Uses of health statistics. Health statistics is essential for A. Planning and budgeting health care delivery. B. Making judicious decisions in health care delivery when available evidence is properly assessed for decision making. C. Monitoring and evaluation of health policies. D. Interpretation of vital statistics such as births, deaths, mortality, and morbidity rates, etc. E. Planning, conducting, analyzing, interpreting, and reporting of medical research. F. Evaluating medical literature, e.g., study design descriptive, case reporting, preventive study. G. Awareness of possible risk associated with medical decisions. H. Handling of variation. I. Diagnosis of patients' ailments and community health problems. J. Prediction of likely outcome of an intervention program in a community or of treatment of individual patients. K. Selection of appropriate intervention for a patient or a community. L. Public health, health administration, and planning. Limitations. A. It might not meet some specific needs because they are often incomplete. B. It is insufficient and might not be suitable. C. Unsuitable format of records. D. Variation in diagnostic criteria. E. Absence of record of the attributes of individuals. F. Inconsistency in data presentation. G. Problems of international comparisons. Sources of health data. There are two main sources of health data: regular or routine systems and ad hoc systems. Regular or routine data collection systems. These usually consist of established procedures for collecting data as they become available. Data from this source include A. Hospital registration procedure, e.g. birth, death, etc. B. A national vital statistics registration system of births, deaths, marriages, and divorces. C. A disease notification system to collect information under international health regulations on cholera plague and yellow fever. D. A reporting system for cancer cases, cancer registration, and AIDS. E. Registration systems in health care facilities to collect information on patients attending various clinics, inpatient and outpatient. F. Census. G. Institutional data. An advantage of this source is the availability of health data. A major difficulty is that such a system may not exist. Even where it exists, there may be deficiencies. The records may be uniform, or they may be unreliable because they are incomplete or inaccurate. Examples: A. A national survey of health personnel, that is, professional survey. B. A survey to estimate the proportion of children with malnutrition in a defined population. C. A study to investigate whether the use of hormonal contraceptive affects nutritional status of the users. D. An investigation of breastfeeding practices among women who registered a birth in the previous year. E. Hospital inpatient inquiry, social survey, epidemiological survey, demographic and other health survey. Other sources of data for health statistics include: 1. Individual persons by examination. 2. Medical records for retrospective studies. 3. Individual persons by interview. Summary of Studies Section 13. In this study session, you have learned that 1. The concern for the health of the citizen and the need for adequate health plans and interventions. 2. The necessity for health statistics. The necessity for health statistics as a vehicle for scientific health care planning. 3. Health statistics serve as the basis upon which government can plan and health managers can assess health trends and situations as well as monitor the progress of various health-related interventions. 4. Health statistics is essential for planning and budgeting healthcare delivery, making judicious decisions in healthcare delivery when available evidence is properly assessed for decision-making. Monitoring and evaluation of health policies. 5. There are two main sources of health data: regular or routine systems and ad hoc systems. This is the end of Studies Section 13. Thanks for listening.